This video provides a short introduction to Lucida Medical's PI solution for prostate MRI. PI is intended to complement the existing prostate cancer pathway. The typical pathway where MRI is performed prior to biopsy is shown here. A patient will be referred for an MRI due to a PSA test or other concerns. He will then undergo a prostate MRI with a protocol compliant with PI-RADS version 2.1. The MRI will then be reported by a radiologist, and if appropriate, the patient will undergo a needle biopsy. Finally, a diagnosis may be confirmed at the MDT or tumour board based on the clinical results, including the MRI report and any biopsy. PI complements the pathway by automatically processing the MRI images using a combination of image processing and machine learning through a connection to the PACS or via an AI integration platform. The PI results are made available for the radiologist to review and complete their report and can be accessed through PACS to support the rest of the pathway. PI is able to support MPMRI with contrast or BPMRI, biparametric MRI, without contrast, as long as images are PI-RADS compliant and of diagnostic quality. PI is particularly relevant for pre-biopsy MRI so that it can support decisions about whether to biopsy and what lesions to target, but it can also be used with post-biopsy MRIs that are performed at least 6 weeks after a biopsy. The PI outputs are designed to assist with a range of clinical scenarios. PI automatically produces a risk score, the PI score, at patient and lesion level. This is on a 1 to 5 scale, similar to a Likert scale, and to the PI-RADS category score. So 5 represents very high risk, 3 is equivocal, and 1 represents very low risk. Depending on the workflow software, these scores can be made available in the worklist, for example, to help with prioritizing cases. PI also produces a segmentation and volume of the prostate and of AI-identified lesions. These are output in a variety of formats, including DICOM secondary captures, which you can see here, and overlays that you can access through your PACS. The prostate volume and segmentation are usually very accurate and can save you manually producing these. The AI lesion candidates are designed for review by a radiologist for reporting and to help with communicating findings through the clinical team. The segmentations can also be exported in RT-struct format for review and for visualization applications such as fusion biopsy using leading systems. And finally, PI can be configured to output an AI-generated preliminary or template report containing the PI findings. Depending on the details of your integration, you can adapt or refer to this in your final reporting. Different hospitals' requirements vary, and we hope that this range of outputs enables you to use PI effectively in your workflow with software that you're familiar with to help you save time and make the most accurate and efficient decisions.